got some good news for you. Hey, everybody, gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. The doctor is in the house. If you have a pain, call a doctor. If you have a sprain, call a doctor. Let the doctor know what you're going through. Let him tell you what's good for you. Because the doctor is in the house. The doctor is in the house. Call a doctor. Call a doctor. Call a doctor. Call a doctor. Tell me what's happening now.
Hey, ladies and gentlemen, welcome to Dr. Ron, Unfiltered, Uncensored. This is your host, Dr. Ron, and we are here weekly to bring you medical news that you can use, medical news that will help you to become the CEO of your own body. Ladies and gentlemen, with an attitude of gratitude, I welcome you to a great program today on probiotics. If positivity is indeed contagious, a number of studies over the past 10 years indicate it may be worth catching, ladies and gentlemen, because this research shows people who display positive emotions like gratitude and forgiveness boast stronger immune systems, lower blood pressure, and fewer symptoms of illnesses. So an attitude of gratitude must be practiced, ladies and gentlemen, and it has beneficial effects, both physically and mentally. This program contains general medical information. The medical information heard on this program is not advice and should not be treated as such. You are encouraged to confirm any medical information obtained from this program with other sources and review all information regarding any medical condition or treatment with your physician. So today will be one of a series of shows we're going to produce on probiotics. And you'll see the title today is, Can Probiotics Help You With Your Weight? Well, we're going to get into that, but there's much more that these organisms can do. They can help with leaky gut, which is now termed metabolic endotoxemia, because that one lining of our gut allows toxins to penetrate. This leaky gut is the driver of obesity, type 2 diabetes, heart disease, inflammatory bowel disease, cognitive decline, immune dysfunction, and even conditions like Parkinson's disease. But really important to this discussion is that the bowel is the host of 70 to 80% of your immune system. And if it goes awry, you lead yourself to have chronic inflammation. And what is that chronic inflammation? It's the cause of most chronic diseases. So I've invited Tim Broder today from a company called Megaspore Biotics, and I asked him to come on a little later to discuss, the particular product that he has and why he thinks it is so amazing. So today, let's just start while we're waiting for Tim. Let's just start with a quote here from Hippocrates. Hippocrates said that nature heals, and it is the doctor's task. It consists of strengthening the natural healing powers to direct them and especially not to interfere with them. And get this, because we'll be talking about this today. The immune system is your number one defense against any disease, not a vaccine. Hippocrates, ladies and gentlemen. And Hippocrates also stated, and we'll start this when Tim gets here, that all diseases begin in the gut. And this is often quoted for a lot of good reasons, because there's been like 2,000 years of medical research and practice since the days of Hippocrates. And these studies continue to confirm his observation that the health and function of the digestive tract profoundly influences our overall health and pathogenesis of disease. You know, especially this past 10 years, the investigation of digestive health and immune function has focused on the gut microbiome. That's all the bacteria that's in our gut. This is a vast ecosystem, and it has increasingly been recognized not only as an influencer of local digestive function, but as part of a bidirectional communication network connecting the brain, immune system, and endocrine systems. Because as you'll find out as we go along, a leaky gut leads to a leaky brain. And if you get this into if your brain starts allowing lots of junk to get in there, including heavy metals, mercury, lead, and glyphosate from Roundup, it leads to a lot of neurological problems, a lot of chronic fatigue, and symptoms which your doctor will not even know what to do because he's not familiar with leaky brain syndrome. All right, before we get on, I just wanted to bring two little bits of information to you. And, you know, setting foot in the hospital anymore is pretty dangerous. But so what are we doing these days? We're going for outpatient services. You can get in quickly. You're not surrounded by a lot of patients that have other types of infection. You think that the staffers know everything in their power and they're ensuring your safety. But there's a new report out you should be well aware of. And it talks about untrained care providers with no accountability. So let's see what this report said. The investigation conducted by a nonprofit independent research group recently exposed the scary truth about safety measures at two major types of outpatient surgical facilities. 321 ambulatory centers, surgery centers, and 1,141 hospital outpatient departments were included in this study, and patients are being put at risk in ways never before revealed, and I'm going to reveal them now. First of all, your care team might not be as educated as you think. This report shows a shocking 35% of those who perform surgical procedures are not board certified. Over a third of people performing surgical procedures are not board certified. As many as 29% of those who administer anesthesia are lacking board certification. Okay? Those numbers are just what the hospital associations and ambulatory surgical care centers have admitted to in public and in non-anonymous surveys. So the actual statistics could be far worse. And why does board certification matter? Because if something were to go wrong during your same-day procedure, you need someone on hand who's been trained to handle the complication and has already been put to that task. If they're not board certified, they could have taken the test and failed it. But even the most trained care providers on hand and in charge could still be at risk. You could still be at risk. Some facilities have also confessed to not using a safe surgery checklist, a bare minimum you would expect from a team that's going to cut you open or sew you back and sew you back up. So these centers are falling short of rigorous standards. You know what? Worst of all is, ladies and gentlemen, hand hygiene. It was found that only 6% of hospital outpatient departments in the new report were found to use electronic monitoring for hand cleanliness. And electronic monitoring was missing from all of the ambulatory surgical care centers observed. Well, you can assume they're washing their hands, but are they scrubbing them enough? Are they really, truly sterile? Without electronic monitoring, you're not going to know until somebody gets sick. So some surgical centers, however, are neglecting to survey their patients after surgery. Maybe they think what they don't know can't hurt them. But I'm telling you this because it can hurt you, and you have to have this information. So we have to hold these centers accountable. So the next time you're scheduled for any outpatient surgical procedure, ask if your surgeon and anesthesiologist are board certified. And if they are not, my opinion would be to ask for one that is board certified. That would mean they've completed all the education necessary to be certified, but just haven't taken the test yet. Following your procedure, if you notice signs of infection, don't wait for the center to call and ask you how you're doing. Contact your provider. File a report with facility management, and go straight to the top. Reach out to governing bodies, accrediting organizations, state organizations, okay, because we have to ensure that we are safe in this area, that everything is done fast and sometimes not as good as we expect it to be, and what is being paid for. So that's my take on surgical centers. Of course, today's topic is these bacteria that keep us healthy, okay, different kinds of bacteria. And as I said, Hippocrates had talked about this over 2,000 years ago. So without further ado, let me introduce a gentleman that I talked to a couple months ago when I got interested in megaspores. And what got me interested in it, what brought me to call Tim, is that I was doing research about electromagnetic fields. And how do we fend off? I mean, we're sort of, it's been called the smoking of today's age. We didn't think smoking was bad 30 years ago. And now I don't think we're giving enough credit for the diseases caused by electromagnetic waves. So, that includes microwave radiation, smartphones, Bluetooth, other wireless technologies, because I feel they're damaging us at a cellular level. We always talk about the mitochondria, the energy portion of our body, the things that provide energy. There's trillions of them. So they're highly inflammatory, these environmental assaults. And as we know, inflammation is the basis of most chronic diseases. And, they think maybe up to 15% of people could be sensitive to this electromagnetic fields. And that's probably conservative because a lot of physicians don't know all the symptoms of electromagnetic sensitivity. But I did find some articles talking about sporebiotics. Now, you've heard about prebiotics, probiotics, but I wonder how many of my listeners have ever heard about sporebiotics. We're going to be talking about them with Tim Broder in a second. Okay, and how this product, I feel, could, help your immune system and not be destroyed in your stomach. And I think as we talk more about EMF in the coming weeks, we'll come back more to this subject. But that's what brought me to Tim Broder. Tim, is that you, sir?
Yeah, I'm here. How you doing, Doc?
I'm doing great, Tim. And I told our audience that, Hippocrates talked about this years and years ago about nature. And he quoted this 2,000 years ago about how important it is to keep our bowels healthy. So, and in his writings, he says, Inflammation in the digestive tract is a critical link between digestion and many systemic inflammatory diseases. So, again, that's why I want to talk to you about this intestinal barrier that we have and what your product does and so forth. So, why don't you introduce yourself and your company? And ladies and gentlemen, I have to admit I have purchased product from them, and it wasn't given to me. I purchased it and have been using it. I'm really satisfied with it. So let Tim tell us who he works for and what he does, and then we'll start talking about probiotics and how his product is different than anything out there. So Tim, I'm going to turn it over to you now.
Thank you, Doc. My name is Tim Broder. I am the Microbiome Labs representative for South and Central Florida. I've been with the company for about 2 years. Microbiome Labs has been around for over 6 years. We basically, our flagship product is the Megaspore Biotic. We carry 11 things, but we are strictly focused on the gut. We have been. We are a science-based company. We're in 13 human clinical trials right now, and all of our products are pharmaceutical grade, which means they are third-party tested, which isn't very common in the supplement market because it's expensive to do. But we think it's worth it to make sure that the product you get now is the same one you get, 5 months from now across the country. It's very important to us because, again, it all comes down to the health of the patient, and that's pretty much it. But I was brought to this company by using the product myself. I have rheumatoid arthritis, and I was attracted to the company because taking 2 or 3 different pharmaceuticals, everything has its place, but it did not get to the root cause of my problem, which is metabolic endotoxemia or leaky gut, and it was spiraling. I was getting worse and worse. So the product actually changed my life enough that I've come to work for the company. That's my story, kind of in a nutshell.
Well, and that's why it's really important to talk, because just because you have leaky gut, as I told our audience, and they know that leads to leaky brain, and the gut lining is only a cell thick. So if that barrier is broken down, fluoride, mercury, glyphosate, Roundup, everything that's going to all pass through your cells barrier and into your body, and then you develop symptoms depending on the state of your immune system. But they also talk about small intestinal bacteria overgrowth, that's SIBO, as also being important in when you talk about leaky gut. But I have a question about is there differences between the probiotic strains that you use compared to probiotics that our patients are buying off the shelves or at Walmart or whatever?
Absolutely. About 95%. I'm sorry, go ahead, Doc. Apologize.
No, I was just going to ask you to explain why it's different. And while you're explaining that, explain why you only have 5 different organisms in your product.
Okay, there's the most common ones you'll see are the lactone bifido strains. In about 90 to 95% of the product, that includes yogurt, milk, anything you want to say, it's probiotic enriched. It's lactone bifido, which are 2 of the keystone strains in your microbiome. They are very, very important. But it's there's a lot of mythology surrounding probiotics in the United States, and we hear it every day. Why is there only 4 billion CFUs in your product compared to 100 billion in another? Why do you not have the keystone strains? Why do you not have this? Why do you not have that? We hear it has to be refrigerated. We hear it has to be changed every 6 months. Well, we have taken a completely different tact. We don't believe that the microbiome can actually be reseeded, which is really what the other companies are pitching. They believe they can drop 100 billion of these CFUs into your system and it can reseed and grow. We don't believe that. The bacillin spores, which we have 5 different strains, the bacillin spores in nature, what they do is they are the caretakers of your microbiome. We used to get these in food. We used to get it from different parts of the animal that we no longer eat. We got it in fruit. We got it in vegetables. These are transient organisms that their job in nature is to go in and almost recondition your microbiome. You were given your microbiome by your mother. Your body takes a snapshot when you're 2.5 years old, and that is the microbiome you're supposed to have, your ideal state. Over time, with exactly what you were talking about, with lack of sleep, stress, glyphosate, mercury, all of these different elements that can change over time. Your body will adjust, but you get die-off, you get heightened lipopolysaccharide levels, which is an inflammatory marker that if it gets through the tight junctions of your intestines and gets through your mucosal layer, gets all over your body, and this causes inflammation. People have different reactions to it, some severe, some not so severe. As you know, Doc, everybody's different. Two people can undergo the same thing and have completely different reactions, depending on your makeup. So what we've decided is that we want to get back to giving you something that you should be getting in your diet, and it actually goes in and gets into your system, passes through your system 100%. That is another difference. Most of the products out there will claim they get through, but we've tested a lot of them. Most of them get eaten up in your gastric system. It's very strong, no matter the coating of the tablet, and ours does get through. Spores are very, very tough. They get through into your intestines. They open up. They colonize. They attack the pathogenic yeast and the pathogenic bacteria, the overgrowth. They attack them 3 different ways. They release their own antioxidants and natural antibiotics. They eat the same food it eats, and they crowd them out. They occupy the same space. So we are basically trying to, again, recondition, get rid of the overgrowth, and allow your keystone bacteria to thrive. Instead of trying to drop extra of those in there, we are actually taking out the competition, which is the huge difference in us. Absolutely night and day.
And that's what I like when you sent me that information, and just what you said, just to reiterate. And it knocks out the competition, but more importantly, the product is third-party tested. So if it says 1 million, you're getting 1 million. You're not getting 3 or 4. I think that's critical if you're going to spend your money on a product to get what you're paying for. And with all the different diets that we're on, and this diet, that diet, and we're just not getting the right type of bacteria. And like Tim said, you get your bacteria from your mother, but sadly to say, that's only it's best if you have a vaginal birth, because as you're coming through that vagina, that bacteria from your mom's body is populating you. Okay, there's a big difference if you're born by a cesarean section. I mean, you'll have some, but not as many as if you have a vaginal birth. So nobody talks about all the C-sections that are done by design and for convenience, but a vaginal birth is really important to this microbiome. So sorry to interrupt there, Tim, but I just want to interject that.
No, and I couldn't agree more. And there are certain factors that will take away from someone. And again, if you're not getting things like that, or to put you behind the 8 ball, if you're not getting the proper bacteria through nature, you're gonna have all kinds of problems. And those of your listeners, or you yourself, Doc, I'm sure you know a lot of patients that when you get certain type of autoimmune things, when you really have bad leaky gut and then you lose that mucosal layer, these things tend to stack one upon another. Someone doesn't just get one thing. If it goes a matter of time, you see people with 2 and 3 conditions, and it just tends to get worse.
Yeah.
So if you don't correct it, you're really just going to be in a bad way.
Right, and then you'll go to a physician who's not trained naturopathically, even though he's an allopathy, hasn't taken the time to learn about leaky gut. He's going to give you a drug for the rheumatoid arthritis, and then you're going to get a side effect from that drug, and then you're going to have irritable bowel syndrome. He's going to blame it on the drug, and now you're in another set of drugs. So, like Tim said, it's a domino effect if you don't get to the root cause of the problem, and we have to think more about our gut. It's 85%, 80% of our immune system. We have to pay attention to it. Some people call it the second brain. That's how important it is.
Absolutely. So, it's funny, right. You were talking about 2,000-year-old. Did you say was it Hippocrates?
Hippocrates, yeah.
Hippocrates was talking about that 2,000 years ago. Same age back in China. They're the ones who nicknamed it the second gut, I believe. Even they knew. So it's important that if these things are true, it seems to be true then. It's still true now. I was at a show with our founders, and it's pretty amazing to hear them talk. They're very passionate about what they do. Everybody for our company is, and they talk about. They're very honest. They said, we know so little that this is a work in progress, but that's why we're in so many clinical trials. We're trying to find out exactly what we can do to help. And I love that about what we do. And we want to do it at their traditional hospitals so that maybe we start to bleed over and people can start to see that this is for real, this is important. And we think we've had a big effect so far.
And just to reiterate, your product is a spore product. How does that differ from the normal probiotic that you get at the store?
Well, first of all, it's going to be completely different strains. There's nobody that's going to do bacillin strains that aren't in spore that are going to be effective at all. And if they do, there's some you see that are soil-based probiotics, and what they'll do, they'll get bacteria out of the soil, and sometimes the spores are in there because these are transient. They're passed from organism to organism, so sometimes they get in the soil. But that's not where let me state that because I do get that pushback from doctors. Bacillin spores are not a soil-based organism. Soil-based organisms thrive in the soil. Bacillin spores do not. If they are in a spore, they're in a hibernative state. They thrive inside of a living being. Okay. This is different because, first of all, they're very hardy. They've been around for millions of years. These are the main difference is the way they're introduced. These will get through your gastric system first and foremost, whereas the other ones, there are some that have a good coating and they get through and they are alive. There's some out there that are alive, but again, if they are air breathers and they're alive, once they get to your intestines, guess what? No air. So what effect are they really going to have? Are they going to be able to reproduce if they get to your intestines and need air to breathe? There's no air in there. So there's a lot of mythology surrounding this. And again, there are several products out there that will help with symptoms. But as far as long-term effects from other products, we're not sure. We don't know because the testing is very vague. It's very vague. Most clinicals that go on are symptom clinicals. How do you feel? Right. 1,000 people felt this way. We took it, and then 800 felt this way. So it works. And again, it can be great symptom relief, but once you stop it, those symptoms come back. It's very similar to what you're talking about with giving someone a pharmaceutical. It might relieve something, but it's not changing anything.
Yeah. And that's why your product did intrigue me when I learned about it, because it survives the gastric acid of the stomach, which is really incredible. And so I haven't done the research, but I dare to say that the lactobacillus products, the probiotics that you get over the counter, if it had a trillion bacteria, I think very few of them would make it to past the stomach into the intestine. And do you study that at all, Tim? About how much of the just a probiotic versus a megaspore biotic?
We have about on the products on the market, the ones we've tested, we're seeing about around 90% never make it anywhere near the intestines.
Wow, that was my feeling. People say I'm taking probiotics, but I'm not feeling any better. Well, you're not feeling any better because they're not working. They're not working
again, and we do get you do have pushback saying that if it's not lactobifido, it's not working well, or bacillin bacteria aren't widely used and studied. Well, they're pretty much the most widely used and studied in the world. It's just that people have this, kind of keyhole view of the world through the U.S. And they have been studied in Europe and Asia for decades and decades and decades. So, we're very confident in what we do. And again, people who've never taken our product before, we've never had an adverse event. It's not going to hurt you. It's natural. And again, there's very few people out there who are doing pharmaceutical grade products in supplements. And we are at hospitals. So this is nothing that's really going to be bad for you at all.
Yeah. Pharmaceutical grade is pure. I mean, it means something.
Yes.
And I think our listeners should know that. And that, again, that's what attracted me to your company and you contacted me. It's pharmaceutical grade. It has a coating that is going to survive the stomach environment to get to where it really needs to be. It has bacteria, 5 of them, that have been studied and that have known effects in the body. I think that's really important. That the company went to all that problem, all the research to study these different forms of bacilli. So really important, and I think it's important. Although on this program we've changed our byline over the last 5 years to just instead of just bringing you information, bringing you medical information that could change your life. Okay, and this right, and these probiotics and this whole thing we're talking about, can affect your immune system. Okay, but that's the second largest part of the neurological system and 80% of your immune system. But there's a lot of things that can go. The gut is responsible for creating 95% of serotonin. Okay, and there's lots of studies that show it can affect brain function and mood. Okay, it may even help you lose weight, and we'll get into that a little later. But there's health issues such as your thyroid imbalance, chronic fatigue, joint pain, psoriasis, all connected with gut function. And yet I'm saying that my peers, my colleagues, most of the time will not address the gut when treating these conditions. Okay, and that's why I want to bring this out to you today, and that's why I want to have guests like Tim, because the gut is really important. There's staggering statistics out there. I even just read a study that showed that the human microbiome contains 360 times more protein-coding genes than the human genes themselves contain. So, gosh, it sort of affects everything, Tim.
Yes.
Okay. And
yes, it does.
And we always talk about getting to the root cause of disease, which is most of the times is inflammation. And here, if we don't take care of our guts, we might be taking other supplements for the anti-inflammatory, but if we don't take care of our guts, we're not really getting to we're not treating the cause properly. So, digestive health it's important for that. And boy, when we what about pay all your clients and doctors who give antibiotics out, and then they tell your patient just go get some yogurt. What do you have to tell them?
Yeah, I went through the same thing with my daughter. Before I was involved in this at all, I was in another life, and she had a series of ear infections being in daycare, like every child does. It's a petri dish, and she had them over and over and over, and she kept getting amoxicillin, and of course she had terrible diarrhea, and the doctor kept saying, just give her some Culturelle. Well, it didn't work, and it didn't work at all. And again, everything's got its place, but I didn't really understand any of it. And now that I do understand it, I've gone back, and I think it always depends on the clinician, but when I speak, when I have the time to actually speak to even someone who's very traditional, when I explain to them the differences in what ours does and what a probiotic's meant to do, and what I find it's much less somebody being stubborn and more about just never hearing things like this before and not understanding what a probiotic can really do. Nobody's ever really explained it. A lot of doctors think, okay, a probiotic's good, it'll help with this, but nobody's really ever explained how they work and how they don't. And so when I've had the time and someone's willing to listen, it's amazing when you see almost the light go on.
Right.
Like, well, that makes perfect sense, but none of this is being taught. It's kind of outside of the realm right now, but we are, again, because of the way we've set things up, it is changing. It is changing very much, and I think you'll see it gradually change more and more.
And I couldn't agree more with you. I couldn't agree more. You know, we had Ralph Moss on our program a few months ago. Ralph Moss is he writes about cancer treatment. He formerly worked at the Sloan Kettering Institute. He's even publishing studies that he reviews about probiotics and cancer. You know, and that's a subject nobody wants to talk about, but Ralph has literature on that, and he's a great guest. He studied cancer for years and years now, and so you know, when I saw him start talking about these probiotics, I said, well, our listeners have to know a lot more about them. So here we are today with Tim from Microbiome Labs. And why don't you tell us how, if our listeners want to look at your products, where do they go?
They can go on microbiomelabs.com. We do sell through clinicians. So, you know, if there's a lot of interest through you, Dr. Ron, I'm sure we can set up something through you. I can give your listeners, if you get attracted to anybody, I'm sure I can get a coupon and we can do something as a thank you. I'd love to do that. But microbiomelabs.com has all of our information, and if you're having any issues with that, you can always go on YouTube, and we have a lot of talks about different things. If you're interested in the microbiome, our two founders, Karan and Tom, do talks, and they're always on YouTube. They're fascinating, and if you don't know much about the microbiome, once you start listening, you'll go down that rabbit hole, and you'll hear things you will not believe. It's pretty amazing.
Okay, and ladies and gentlemen, that's a great offer from Tim. And the next time we do a program on probiotics, you know, we're going to invite you. We'll do it live. This program here we are recording to play at our regular scheduled time on Tuesday. But we will have a live program with Tim as a guest, and if you call in, and we'll give you a code number or whatever, and then, you know, take it to your physician, and I guess that's the way it would work, right? They would take it to their physician, and he would order the product for them.
Yeah, something along those lines. You know,
yeah,
we'll
work it out.
We'll figure it out. We'll figure it out.
Yeah, we'll work it out. But I mean, Tim was just nice enough to offer that now. So when we do a live program, I just wanted to get this information out because it's so important for overall health. There's studies out there to suggest that the probiotics could prevent cavities. So why not take the best? How many women are fighting chronic urinary tract infections that maybe could use a good strain of a probiotic? And as Tim said, rheumatoid arthritis. I mean, gosh, almost every patient with rheumatoid should be on a good probiotic like microbiome cells. Kidney stones, does anybody ever think that there are probiotics that potentially help with that? Well, the probiotic can help to degrade the oxalate, which causes kidney stones. You know, and oxalates in spinach and dark green vegetables, right? So researchers are getting interested in that area too, okay? And how about weight loss, ladies and gentlemen? Probiotics have been proposed as a part of a weight loss diet for years now, but there's a 2015 meta-analysis that looked at available randomized controlled trials investigating this effect and determined that the study did not seem to support this hypothesis, okay, because they said the body weight wasn't consistently reduced. But the researchers left themselves a way out at the end of that study. They weren't convinced the study was any good anyway. But I want to go back, and while Tim is on here just for a second, to something I brought to you. Let me just see. I think I brought this in 2014. I said, your belt is so long you could lasso a calf with it. The last time You saw your toes. You took a black and white picture of them. You remember that? I call it the Santa Claus syndrome. My belly's so large, even the heaviest coat can't hide it anymore. You know, no matter what you put, you still got that bulge. So if you want to stop that stomach from jiggling like a bowl full of jelly, you have two choices. You can let one of the surgical sadists come in and hack you out, hack the fat out if they don't kill you first, as we talked about earlier. Or you can pop 2 safe natural pills a day and watch the pounds melt away. So 2 pills a day, let the fat melt away. Like I used to tell you, get your meat off the seat. So this study was in Canada, 2014, before I knew anything about microspores. They tested probiotics and with the healthy gut bacteria, and they found it could be the key to controlling your weight. Gals who took probiotics daily for 12 weeks lost 10 pounds, and here's the really good news. They kept the weight off. So it looks like these 12 ladies, okay? So what I also said back then, it's no secret that thin, healthy people have different gut bacteria than folks who are carrying around a spare tire. If you want to get your hands on some of that good skinny guy bacteria, take a probiotic, which is better, I said, than licking the door handle at the gym. So you go out and buy the stuff. So probiotics can reset healthy bacteria levels in your gut, but you need to make sure you don't go fooling them up, get them all fouled up again. You got to skip the carbohydrates. So that's something we have to keep talking about. Even though you could be taking the best of any spore product, but if you have a lousy diet, okay, it could just reset you back to zero. So you got to skip the carbs and the sugar that rots your organs, and then you might be able to start losing weight again. But I said that in 2014, Tim.
And that is a good segue, Doc. So I know I want to come talk to you again, but one of the things I want to talk to you about is when we have a new product coming out that we believe is going to be revolutionary, and it is we designed it for one thing, and it looks like it jumpstarts your short chain fatty acids, something we're doing specialized, and everybody we've given it to has seen pretty significant weight loss. So when that comes out, I will be back on your show to talk about that and talk about the science behind it, because that is a probiotic, but it's going to be specialized for people with Crohn's and colitis, the inflammation. But one of the side things we've seen is that it is jump-starting the short-chain fatty acid, which in turn kickstarts your metabolism and burns through fat. And it's safe. Doesn't hurt you. Wow. It's all natural. So we're excited. I mean, that one's been in production for like 3 years.
Well, I may have to revise my chapter on inflammation by the time I go to press if this starts to be significant, because the basis of my book is if you can control inflammation, you can help with anti-aging and longevity. So, and I do talk about probiotics, but more in a general form. But until I saw your product, I'm really enamored with it, to say the least. So I want to thank you for coming on today. At least help me introduce the subject to our listening audience again. You got a little tease in there with a new product. I like that, and we'll look forward to hearing from you. And we'll do probably after the holidays, do another series of programs on leaky gut and irritable bowel and the role of probiotics. So we'll have you back then, and we'll talk. So thank you for taking your time today. I really appreciate it.
Hey, anytime, Dr. Ron. That was my pleasure. I enjoyed it, and looking forward to the day we can go live and have people call in, and we can help them too. This stuff helped me, and it's you get any type of these things, these autoimmune things, and basically what I describe them as, it's an absolute life disruption. You just want to be normal, and if we can help more people do that, just like it helped me, I'm all for it. It's a great thing.
All right. Well, have a great afternoon.
Thanks, Doc. Have a good day. Okay.
Thank you. Yeah, I appreciate your time.
All right.
So, ladies and
Bye-bye.
gentlemen, we've been talking with Tim of Microbiome Labs with the Megaspore product. And, but please, besides taking a product, eat more sour foods. Okay. That way you get some things naturally, get some healthy sour foods, like apple cider vinegar, maybe twice a day. Really great for you. And maybe consuming more fermented vegetables like sauerkraut, kimchi. Okay, really, really important to have a lifestyle where you also consume more probiotic foods like goat milk, yogurt, and I'm surprised how many people don't know about kefir, miso, and kombucha. Okay, it really helps with your bacteria. And then, feed the probiotics that are in your system. Once they start growing and it's getting rid of all the bad stuff down there, a good high-quality fiber can actually cause probiotics to increase in your body. So a good high-fiber diet. Healthy high-fiber diet includes organic fruits, vegetables, and sweet potatoes. Again, make sure the probiotic you take is a quality one. And it's important that you listen as we keep developing this to learn, if there's others beside Megaspore, but this is the one that only spore product I could find right now with a good quality control. The bacteria survive; they survive the stomach, and gosh, what can I say? I think that this is a subject we have to continually educate ourselves about. So there are other studies about obesity, ladies and gentlemen, though, with probiotics, and a lot of them are positive. The ones that were negative did not use the great strains of probiotics, and they sort of were deemed to fail before they even started. Like I said last week, if you use penicillin to treat dandruff, it's going to fail. So if you don't set up your experiment properly, it fails. So, all right, so that's just our introduction to probiotics and the product that I like called Megaspore Biotic. And I hope you gather something from this and learn something about probiotics, because they do affect our second brain. They do affect a leaky gut, which can lead to a leaky brain. And diseases like Parkinson's disease and Alzheimer's probably have a basis in what we're talking about today. So it's important that we keep our bacteria in our gut populated with good bacteria, and we don't destroy them by eating a high sugar, highly processed diet. So, ladies and gentlemen, I want to thank you for listening today, and we will see you next week on the radio. Have a great week. Ladies and gentlemen, thank you for listening to Dr. Ron, Unfiltered, Uncensored, with your host, Dr. Ron. We are here each and every week. Thank you for taking the time out of your busy schedule. We bring you medical news that you can use. Medical news that's up to date on drug reactions and interpretation of medical articles. We also have some great guests scheduled. So thank you again. Have a great week. Listen to us on Apple, Alexa, iHeartRadio, TuneIn Radio, Spotify, Stitcher. Ciao.